Dysmenorrhea. Dysmenorrhea is defined as pain during menstruation. It is usually cramping type of pain in the lower abdomen. Dysmenorrhea is of two types: primary dysmenorrhea, secondary dysmenorrhea. Primary and secondary dysmenorrhea. Primary or spasmodic dysmenorrhea. Pain occurs during the ovulatory cycle and it is because of the myometrial contraction. Due to the prostaglandin release due to sudden decrease in the progesterone, the PGF2 alpha, and it is not associated with any pelvic pathology. Patient is usually a young female with complaints of pain during the menstruation since 1 to 2 years after menarche. Initially no pain because the cycles were anovulatory. More common in females who have early menarche, increased intermenstrual period, increased menstrual flow. Pain gradually decreases on its own after some physical activity, after marriage or childbirth, and reassurance should be given. Pain begins with menses or just before the menses and gradually decreases within 72 hours. Pain is spasmodic in nature, intermittent and varies with intensity. Pain is centralized and in suprapubic region, may be associated with the psychological factors. Secondary or congestive dysmenorrhea. Pelvic pathology is present in this, and the causes may be endometriosis, which is the most common cause, adenomyosis, fibroid. Patient will be a female in reproductive age group more than 30 years with complaints of pain during the menses present for the past few months. Pain occurs much before the onset of menses and remains even after the onset of periods. Pain is congestive in nature. Intensity of the pain keeps on increasing, that is progressive dysmenorrhea. Pain is localized. Dysmenorrhea may be associated with the dyspareunia and dyschezia. Dyschezia means painful defecation, and dyspareunia means pain while having coitus. Management of primary dysmenorrhea: NSAIDs, OCP, vaginal rings, levonorgestrel, Mirena. Levonorgestrel makes the cycle anovulatory, and OCP makes the cycle also anovulatory, and also the synthetic estrogen has negative feedback on FSH and synthetic progesterone has negative feedback on LH. Vaginal rings can be given. Secondary dysmenorrhea. Treat the cause of dysmenorrhea. The pain at the